Enuresis or bedwetting, a terminology which is used quite commonly in the children's age group or the pediatric age group, is a phenomenon that needs to be watched. From the age of 6 to 15 years, when children actually are rapidly moving up the ladder on milestones, it's important to safeguard their health and their morale and their courage and all the aspects that would actually keep them in the discipline of progression. Will be to actually look at picking up bedwetting and treating them in time. Many a times parents may not be motivated or parents may not be aware. They would know, and probably it's thought about in medical science too, that majority of the children actually get dry as age increases. Obviously, with progression brings about various changes which happen between the brain and the bladder rhythm. And the rhythm is actually which is being brought about by mothers in a toilet training in the daytime could develop to quite a good amount of level with changes happening overall in the environment of the body, but not in everybody. In other words, children between 6 to 15 years who are bedwetting every day, bedwetting even once a week, or who knows are bedwetting twice every night are kind of candidates whom we need to treat in time. It's completely curable. So why not cure them in time as a primary nocturnal enuresis rather than wait for them to continue bedwetting once a day, once a week, once a month, or multiple times, and obviously living in a lesser morale and anxiety. Some children actually are scared to go to school because they are getting a tough time at home with parents around, don't know what to do. Some are ashamed about it. Some drop school, and some actually develop it after having cured completely. So bedwetting or enuresis is treatable. It's treatable in time to look at the morale and look at the milestones of children being continue to develop the way you and I dream for. But if not done so, many of them continue to become bedwetters even in their adolescence and adulthood. Not a great idea to leave something which is visible to you and correctable for a later date or for somebody else. So in pediatric age group between 6 to 15 years, I possibly feel that between 6 to 10 years are those children who may not be so much motivated. For them, it's still playing at toddler age group and beyond, and they're still coming out of it. It's where the mothers and fathers are more important individuals to be motivated. Motivating them in a school talk, motivating them across the table, motivating them in many ways, like the one we are attempting to do today, will be an important aspect. An aspect where a mother understands that my child, my girl child, or the young boy needs to be brought about dry and therefore more confident in time, rather than leaving it alone for a later date. For age group between 11 to 15, 11 to 16 is the age group where children are more motivated. They're motivated in so many things, and the motivation is visible across on many aspects where children are scoring so well. So those kind of children made aware itself in a program, which could be even a school program or in a kind of a children's program. Anybody and everybody who has it could probably go and see the right doctor, a urologist, a pediatrician, or a colleague of ours who deals with bedwetting. Remember, at the Kokila Hospital and Department of Urology on the second floor, we actually run a walk-in bedwetting and nocturia clinic. A bedwetting clinic for all parents who could just walk into the afternoon after the school time is over, the child could come along. We could probably have a healthy discussion and look at identifying those children who are bedwetting, looking at the causes, identifying those who have got primary nocturnal enuresis or bedwetting since childhood, and look at deviating the path from the natural history of continued progress on this aspect while they're not improving. So deviating them from that and bringing about a dryness into the life is what we aim for. We look forward to good mornings and better days rather than living with nights which are wet around. So wet nights are not acceptable. In other words, if you continue to drink good amount of liquid in the evening and nights, if you continue to drink 2 glasses of milk before you go to sleep as children, we possibly have been challenging our body, our kidneys, and our bladder to be able to return. And in the retaining capacity, which may not be possible in all children, many of the children would bedwet. So it's seen that many of the children actually would drink glasses of water and milk after their possible dinner, which is always late now, and things do change completely. And therefore, a lot of behavioral therapy is important in the discipline of care that we bring about. In bedwetters, it's important that they have their dinner at least 2 hours before they go to sleep, complete their water intake in time, rather than continue to drink till the last time when they switch the lights off. It is important that we look at that aspect. We cut down the beverages of all liquids in the evening time. That's an important aspect also in nocturia, or getting up multiple times at night, where if more amount of water is subjected to the body, the kidneys have to produce that amount of urine because they don't want extra amount of water in the body. That's all homeostasis which kidney maintains around. And more water coming into the body is only going to produce more urine. And that at night will only overwhelm the whole capacity of the bladder, where in children, the bladder is still learning and training itself. So friends, for all practical purposes, bedwetting is completely treatable. It's important for you to see your urologist in time in children between 6 to 15 years. Lest if you don't do that, we get children at the age of 16 and 20 years too, who are still bedwetting and don't know how to go to the hostels, how to lead a more disciplined life, and how to probably come out of this depression that they're living in. So let's not allow children to come to a point where they feel depressed, they're underperformers, they possibly are not what they could be if these kind of confounding factors were removed from them. Bedwetting is completely treatable, and to leave bedwetting to another day, to another age group, is what is not acceptable. So all children between 6 to 15 years today should look forward to them getting treated. Obviously, at the earlier age, as I said, a lot of behavioral therapy, which is brought about by parents, number one. Number two, there's an alarm therapy, which we work on very, very clearly. In other words, a lot of quality of life diseases where the patients or the parents are involved out there, getting up an hour or two after you go to sleep is one way of bringing about a rhythm and change in the behavior of the entire aspect when you go to sleep. On the side, there are medications today, and those medications are greatly helpful, beneficial, without side effects, which handhold the journey of you getting better and better. So I think overall, it is an important message today to all children, all parents, all schools, that we need to look into a program. We need to look at bedwetting aspect, looking at not cutting down their morale, not making them underperformers by continue to bedwetting. It's an important milestone which should be curtailed and completed before we grow to the age from 5 to 6 and 6 to 8 and 8 to 12 and 15. It's important that we also look at one small aspect where a child was completely dry and then starts getting wet again. This is called a secondary nocturnal enuresis, and there could always be causes. There could be causes of stress in a child. There could be causes of constipation, change of school, change of city, change of friends, or stress at home with parental issues. It's important to identify the secondary nocturnal enuresis, equally important. Some children could have daytime issues where they've got urgency frequency along with the nighttime bedwetting, something which is called as a polysymptomatic enuresis, and something which needs to be looked into and evaluated. So treat the days and treat the nights both in such individuals. But overall, with Nocturia and Bedwetting Clinic at the Kokilabhen Hospital and the Department of Urology, we'll be inviting more and more people who get aware about these issues and coming in time and getting treated and cured. It is important for this awareness drive to reach to all children, all parents, where we look at more and more children turning dry, more and more adults having a better sleep at night rather than getting up multiple times at night out of nocturia. Thank you so much.